Hey, this is Dr. Renfrow. Let's talk a little bit more about corrective care, upper cervical care, and the timeline that involves. Many people want to know how long it's going to take for XYZ symptom or condition to improve. And the answer is that it's going to be different in every case, and it's going to be relative to the amount of damage in the spine. So, very briefly, damage in the spine is related to accidents and injuries over time that accumulate. Accidents and injuries cause something called vertebral subluxation, which is one or more joints in the spine that have become unhealthy. That's going to affect the entire spine through something called compensation, where the spine is imbalanced, and so the rest of the body is imbalanced, and the spine will lose its normal curvatures and develop abnormal curvatures. Because it's not moving properly, then it enters into degeneration. And so this is the beginning of degeneration, degenerative disc disease, degenerative joint disease, spinal osteoarthritis, whatever you choose to call it. Any joint in the body that's not moving properly is going to wear out much faster than a joint that is moving properly. Any joint that is moving properly is going to maintain or regain its health in time. So accidents and injuries, most commonly overlooked in healthcare as a cause of long-term problems, because the accidents and injuries that cause conditions and symptoms are years apart. So we're talking 10, 15 years between the accidents and injuries causing the subluxation almost immediately, but the compensation and the degeneration that's going to affect the nervous system in time. So as we're identifying damage in the spine, we use different tools. We use X-ray, sometimes CT, sometimes an MRI can be used. We're also going to use things in the office like uh, thermal readings. We're going to do thermal testing. So we can take a temperature reading of the spine and see where there's abnormal neurology, and that can indicate areas of the spine where there's more damage that's affecting the nerves more drastically. And then when we know what levels the damage is at, we know roughly where the nerves go to in the body and what kind of health conditions or symptoms are related to that damage in the spine. So just with this individual here, we see a lot of damage at the base of the neck as well as the upper back. We might expect something like maybe neck pain or stiffness if the degenerative process is relatively advanced, but a lot of times people don't have pain as this process is developing. Might see numbness and tingling into the arms, maybe a condition like carpal tunnel syndrome, maybe chronic conditions that pop up every now and then, maybe something like bronchitis that pops up year after year, laryngitis, something like that. The neurology related to this level here at T1 is going to be involved with the lungs. So we might expect this individual to have a history of asthma or maybe breathing difficulty, especially when they're under a lot of stress. They might experience chest pains and they've had them checked out. And the doctor says that they're not having a heart attack or something like that. The nerves from this level or T2 are related to the heart. So we might also expect changes in the function of the heart, arrhythmias, things like that. Could definitely contribute to heart conditions due to the function of the heart not being normal because of the neurological interference related to the damage in the spine. Down here in the lower spine, this is L1 and L2. Very commonly, we would see maybe a pattern of constipation or diarrhea, changes in the digestive system, maybe indigestion. Down here at L4 and L5, just about any symptom that occurs in the lower back or into the legs, including numbness or tingling in the feet, sciatica, pain, imbalance in the legs, in the hip joints. We might expect to see changes in prostate health, changes in urinary patterns, changes in um, the bladder. There's many different possibilities when you have damage at specific levels in the spine because of the um, the vast influence of the nerve system on the health of the body. So what does the timeline look like? Well, when we get somebody under care and we begin to apply adjustments to the spine, they're going to begin to improve fairly quickly. Now, improvement doesn't always look like the symptom going away immediately. Improvement means that the spine starts to realign, starts to move normally again. And this comes with a lot of changes in tissues, maybe breakup of adhesions or scar tissues that have developed in joints over time. And so a lot of times individuals become more sensitive in the initial parts of the care phase. Sometimes it's a rocky time for them as their body actually starts to make improvement for the first time in a long time, takes stress off the nerves, allows the nerves to begin functioning better. Generally, the first repair phase will last about 6 weeks, as long as the individual holds their adjustment. At the end of 6 weeks, they will pass into a rest phase, which incorporates a different aspect of healing. So in general, healing and the natural healing of the body happens in 3 different phases. Initially at the initial damage, or in this case, when the damage begins to reverse, inflammation will take place. A lot of inflammation, as that's the first thing that the body does in the healing process. Inflammation will give way to a process called proliferation, and then proliferation will give way to a process called remodeling. And so this is similar to what the body goes through in these healing cycles. The rest phase here it entails more remodeling of soft tissues, cellular correction, where that individual is not gaining much improvement in the ranges of motion or the joints. The joints aren't opening up as much as the cells are correcting and replacing to stabilize that improvement that's been made. So that as long as that individual holds their adjustment, as long as they're adjusted when they need an adjustment, we'll go into another repair phase, followed by rest phase, followed by repair phase, followed by rest phase, where the damage in the body will continue to repair slightly in each phase. And these cycles occur over 90-day windows. So roughly 3 months is one cycle. And so as long as we keep somebody in balance, aligned, adjusted when necessary, they will continue to improve. And that's why their health will continue to improve under corrective care. So that's a little bit about the timeline. Basically, it's dependent on how much damage there is in the spine that's causing the condition. If that damage is able to be reversed, then we can, or if that damage is able to be improved, possibly reversed, then we will expect that condition related to that level of the spine to improve according to how long that condition has been around. But either way, it's not just treating one individual symptom or condition. It's the health of the entire body that's in question. So I hope that helps, and I appreciate your time. Thank you so much.